Okay, good evening, friends. I think in this age, heart failure is becoming a very important topic in our practice because we are seeing more and more patients of heart failure day in and day out. As the longevity is increasing, so is heart failure. We are recognizing heart failure more these days, and good modalities of investigations and treatment are available to treat heart failure. Now, what is heart failure? Heart failure is basically the inability of the heart to pump blood to the periphery, to all the vital organs during rest and during exertion. Now, heart failure can be both, as we say, systolic and diastolic, or it means the inability of the heart to pump blood outside to the periphery, or inability of the heart to receive blood during rest. And which kind of patients develop heart failure? Usually uncontrolled diabetics, hypertensive, patients who have had coronary heart disease, patients who have had valvular heart disease. They are the kind of patients who are prone for heart failure. And heart failure can be very slow, can be very insidious, or can have devastating signs and symptoms. The commonest first symptom of heart failure is easy fatigability. The patient gets tired. The patient walks from the car park to the door, feels tired. That is the first sign. And as the heart failure worsens, patient develops breathlessness, patient cannot lie down flat, patient develops swelling of the feet. These are all common symptoms which should not be ignored. Also remember that heart failure is treatable well with lot of lifestyle modification, with control of blood pressure, good control of diabetes, and lot of changes in the lifestyle. Like if you stop smoking, control alcohol, restrict salt, restrict fluid, and the patient's heart failure can be managed very well. Otherwise, heart failure can be fatal, and we have almost 2 to 3% of our population who are suffering from heart failure, which is a fairly large amount in terms of our population. So I think we must recognize heart failure quickly, treat the patients, and give them a better quality of life. A lot of new drugs are available, new therapies are available, new investigations are available. They need not be complex. Simple 2D echo also can give us an idea about heart failure. It doesn't mean that there should be a drop in the ejection fraction on 2D echo. Sometimes heart failure can be with preserved ejection fraction or can be with reduced EF. The treatment modalities are different in both, but both are heart failure. So normal 2D echo does not rule out heart failure. You must keep that in mind. And the first sign of any of these symptoms, one must seek medical attention. One must control diabetes very carefully and strictly. Get your A1C down to 7. Get your blood pressure to very good permissible levels of 120/80. Get your heart disease corrected either in the form of intervention by angioplasty or by bypass. Correct the heart rate. You must pay attention if the patient presents with palpitations also. So we can have a good quality of life for our patients using the right drug in the right proportion and carefully monitoring the patients.